Hi, Dr. Sive Gallagher. I'm a plastic and reconstructive surgeon with a special interest in gender affirmation surgery. And so today's question I'm answering is, how do we do masculoplasty or drain-free surgery? How do we get away without the drains? So it's actually not that much of a mystery. It's kind of a simple thing, actually. And years ago, before I worked in gender affirmation surgery, I actually published some research on using this technique for abdominoplasty or tummy tuck surgery. And we kind of pushed it to its limit in that particular type of surgery and published our results, and we found that the results were pretty darn good when we used a special technique called progressive tension suturing, which I did not invent. It really should be attributed to two related surgeons. I think it's brothers, Pollock and Pollock. So basically what they came up with, which was genius, was simply quilting down the dead space. So when you take out breast tissue, you have space left behind. If the body is left to its own devices, it's going to want to fill that space with fluid. This fluid is serous fluid. It causes a thing called a seroma. If a seroma gets infected, that causes a thing called an abscess, which is really not good. So seromas are bad. So what traditionally was done at the end of the surgery, the patient would remove the breast tissue, then you just pull the skin edges together and you have space left behind. So what you do is you put a suction device in there, so a drain which will suck out that fluid. So in masculoplasty, what we've done is very simply we've gotten rid of the dead space so that it is no longer an issue because there is no dead space behind. So if you imagine, we put rows of internal sutures. We use a large suture, a 1 vicryl for any of you guys who are medical, and we place a few of those. It adds maybe about 10 minutes to your procedure, not very much at all. And in this way, we shut down that dead space so that no dead space is left behind, so there is no space for fluid to form. And we've also shown in our studies that it decreases the major risk of gender affirmation top surgery, which is hematoma or bleeding into that area. So in this way, just putting rows and rows of these quilted sutures, are not even that many. We don't even need that many. We're able to avoid drains and give you all the beautiful advantages that come along with a drain-free surgery, such as decreased pain, ability to take a shower sooner, and lower complication rate, which of course is the most important. So I hope this helps clear up exactly what is the magic behind it. It takes a little bit of training or technique. You know, it's not everybody can do it just immediately, but from the patient's perspective, I firmly believe it's really the only option or the best option in 2019. So I hope this helps.